My name is Kelly Jagelski, and I'm the client manager for the Horton Group. Horton assists the city with its benefit programs, and we can also assist with claim issues. Today, I will provide an overview of the benefits and open enrollment process for 2021. Today, we will review the medical, dental, and vision plans and walk through the FSA and HRA accounts. We will talk about opting out of coverage, the 2021 open enrollment, and we will talk about a change to the long-term disability program, which will now be offered through ETF. Open enrollment is the one time each year when you can make benefit changes without having a qualifying event. You can add a dependent, remove a dependent, or add or remove coverage. Coverage you are electing now will be in effect for calendar year 2021 unless you have a qualifying event. Enrollment forms must be turned in no later than December 4th. Qualifying events allow you the opportunity to make changes during the calendar year as long as you provide the appropriate paperwork documenting the qualifying event within 30 days. You have up to 60 days for the birth or adoption of a child. There are no medical benefit changes for 2021, and premiums will not change. WCA continues to offer the annual exam reimbursement benefit. Teladoc provides a treatment cost calculator, and you are eligible for a portion of the savings if you discover and correct an error on a hospital bill. There are no changes to the medical plan. We illustrated both in and out of network benefits, but I will focus primarily on the in-network benefits. The plan has a $2,000 per person deductible, up to $4,000 for those with family coverage. The out-of-pocket maximum includes deductibles, coinsurance, and non-prescription copays. The plan pays 100% for most services after the deductible has been met. Emergency room care has a $100 copay and then the deductible. Urgent care has a $25 copay, then the deductible. An office visit for primary care has a $10 copay, then the deductible. Specialty care has a $50 copay, then the deductible applies. There is no cost sharing for coverage through Teladoc. Preventive care is paid at 100% in-network as long as billed as preventive. The prescription drug copays remain the same, and they count towards the prescription drug out-of-pocket limit of $2,000 single and $4,000 family. The HRA reimbursement amounts will remain unchanged for 2021. HRA reimbursements are handled through diversified benefits, and you have to pay the first $750 of the single deductible and $2,500 of the family deductible to qualify for reimbursement. It is recommended that you send in each explanation of benefits to diversified benefits so that you get reimbursed as soon as possible. There have been no changes in providers, but this illustrates how to find a provider. The plan continues to include an annual exam reimbursement benefit, which allows the employee and spouse to each earn a $50 gift card once per calendar year. Please contact the HR department for a copy of the reimbursement form. The hospital bill audit program rewards you with a portion of the recovery amount if you discover and correct any errors on your hospital bill. Contact WCA or UMR for additional details. The healthcare cost estimator is now called the treatment cost calculator and can provide cost estimates for hundreds of healthcare services in your area. The steps for using the treatment cost calculator are outlined for your convenience. The UMR Premium Designation Program provides members information about physicians who have already demonstrated quality and cost efficiency. Currently, the Premium Care Physician Program evaluates physicians in 16 different specialties and 47 subspecialties against national and medical society standards. Specialties range from primary care to ENT, cardiology, and orthopedics. Physicians who meet the quality and cost criteria are designated as premium care physicians and will have the 2 blue hearts icon by their name. Members can access this information through the online provider directory. We hope that access to more information leads to more informed choices. It is important each time you need services that you think about the best place to seek care. This shows the cost of care similar to a restaurant guide with more dollar signs for more expensive care. Teladoc services are available at no cost. Retail clinics are generally less expensive than primary care. Specialty care is more expensive than primary care. Urgent care is more expensive than emergency room care. It is often $1,300 or more for an emergency room visit. You may have seen the commercials, but I wanted to take a couple of minutes to explain the GoodRx prescription savings program. For the basic GoodRx program, there is no membership fee, but you can receive discounts of up to 80% off the cost of medications. You can choose to go to the GoodRx website or use the GoodRx app. I will use my husband as a recent example. He obtains his prescriptions through Meyer Pharmacy. He is on a high-deductible health plan. The pharmacist ran his prescription through the health plan, and they gave him a cost of approximately $30 for his nasal spray. I typed in the name of the nasal spray through the GoodRx app, and the cost with the coupon at Meyer was $12.18 as opposed to $30 through the health plan. The pharmacist reran the prescription with GoodRx, and we saved $17.82 on that one prescription. One of the ways that GoodRx can offer savings is that they don't work directly with insurance. That means the cost generally does not count towards the plan out-of-pocket maximums. You may still find this to be beneficial, especially if you don't normally meet your plan's out-of-pocket maximums. There are a number of online videos that explain the Teladoc program. This slide illustrates some of the common medical conditions where you can seek care. It is healthcare on your terms and convenience. You can consult with board-certified doctors 24/7, 365 days a year by phone or online video, and there is no cost to you for the use of the Teladoc program. You can also use Teladoc for mental health services, to talk to a therapist, or for dermatology services. Within minutes, you can be speaking to a doctor, getting a consult, and addressing your issue. If you need it, you can get a prescription sent directly to the pharmacy of your choice. 91% of people who use Teladoc get their issue resolved, and Teladoc has a 95% satisfaction rate. This walks you through the process of requesting a consultation. Medical plan contributions will remain the same for 2021. The opt-out benefit amount for 2021 will continue to be $5,000 per year. You must provide the opt-out form and a copy of your other coverage. Diversified will continue to administer the FSA and the HRA accounts for 2021. The healthcare reimbursement account allows you to set aside money on a pre-tax basis in order to pay for healthcare expenses. As a reminder, you can now use FSA dollars to pay for over-the-counter medications without a prescription. You should estimate your healthcare expenses for 2021. The most you can set aside in your FSA is $2,750. Please be conservative in your estimates, as you can only carry forward $550 of unused funds into the next calendar year. One of the advantages of the healthcare reimbursement account is that you can have access to your full annual election at any time in calendar year 2021. We have illustrated some common examples of expenses that can be claimed under the healthcare reimbursement account. If you or a spouse contribute to an HSA account, you cannot participate in the healthcare reimbursement FSA. The dependent care reimbursement account and the healthcare reimbursement account are separate accounts. You can use the dependent care reimbursement account for tax-free reimbursement of child or dependent care expenses. The provider can be a daycare center or a private individual. You must provide their tax ID information or the Social Security number. You can set aside up to $5,000 for someone married filing jointly for dependent care expenses. The daycare expenses must be while you and your spouse, if you are married, are working, seeking employment, or attending college on a full-time basis. You must report your daycare contribution on Federal Tax Form 2441. For dependent care, you may only access up to the amount contributed from your paycheck. You should consult your tax advisor to determine which option may make the most sense. In addition to online filing, you can also file claims through the Diversified mobile app. This chart illustrates the process if you need to file an HRA claim manually. You can contact Diversified at the phone number provided or view online. Health reimbursement dollars will be a single amount for the calendar year. This is important if an employee leaves to join a spouse's plan and returns to the city's plan, as they will not get an additional amount for the calendar year. Amounts will also be prorated for those hired during the year. Anthem's dental plan incorporates the very latest dental technology and offers incentives to encourage proper preventive care. You're 100% covered for regular exams, cleanings, and x-rays from a dentist in the plan. Take a moment to review the details of your dental plan. There have been no benefit changes to your dental plan in 2021. This slide illustrates how to find a dental provider. Anthem gives you the option to ask a hygienist questions and get a response within 48 hours. There is also a dental cost estimator tool on Anthem.com to compare costs before you seek care. Anthem also has some special offers for items like Pro Clear aligners. Special offers are available on Anthem.com for vision, hearing, and dental services. Anthem also provides discounts on things like gym memberships, weight loss programs, and many other items. The dental contributions will remain the same for 2021. The Vision Plan continues to be offered with no changes in benefits or costs for 2021. There is no deductible or copayment for exam or materials. Exams, lenses, and contact lenses, in lieu of glasses, are available every 12 months. Frames are available every 24 months. If you want to achieve the best benefit, you should see an in-network provider. Frames are covered up to $125 retail allowance. Contact lenses are covered up to $150 retail allowance. Out-of-network benefits are only covered up to the dollar amounts as illustrated. There are also a number of discounts available on lens options, non-covered services, LASIK, or hearing discounts. To find a provider, visit superiorvision.com, find an eye care professional, and remember, your network name is Superior Select Midwest. Superior Vision also offers you a number of benefits if you wish to shop online through 1-800-CONTACTS, BeFitting, Glasses.com, or Contacts Direct. Creating a member account is easy. You can find a provider, view your benefits and eligibility, print your ID card, download forms, and much more. The Vision contributions will remain the same for 2021. The city is changing carriers for long-term disability coverage. The new coverage will be offered through the Wisconsin Retirement System. This benefit will begin after an elimination or waiting period of 90 days. The benefit amount is 75% of earnings from the previous year up to a maximum benefit of $4,000 per month. This covers salaries of up to $64,000 per year. This coverage will be provided in full to eligible employees. Employees with salaries above $64,000 can elect supplemental coverage on a voluntary basis. The benefit duration is also illustrated. You will need to complete and turn in the enrollment form for the long-term disability coverage. Submit your benefit election forms to the Finance Department no later than December 4th. You must file a form even if you are not taking any of the benefits. You must have the information for all of your dependents on the enrollment form and select the level of coverage you want for each dependent. Thank you for your time.